Yeah.
Okay, well, thank you so much for joining us. My name is Valerie Martinez, and we have been working with Beach Cities Health District since about April to begin having this discussion about the project that we're moving forward. All right, we are looking at a project called the Healthy Living Campus Project, and we're trying to make sure that we have a multi-generational project that will also ensure that our communities are able to age in place. So very quickly, because I am not the key speaker today, we have people who have some really great information here, but I'm going to do a couple things, okay? I'm going to introduce kind of what we're doing tonight, so we'll go through the agenda a little bit, and then I'm also going to help with the facilitated Q&A at the end. Okay, so what you will be hearing today is about beach cities in general, because some folks, beach cities is kind of a new organization, so we want to be able to explain what that is. We're also going to talk about the Healthy Living Campus Project, what that looks like, why it is, what we're doing. The continuum of care, why it's important, what are the health benefits. And then we're going to talk about the community input process. What have we been doing and what are we going to be doing moving forward? As well as answering some basic questions, again, through the facilitated Q&A process. We're here because we want to unveil this project, and I need to emphasize that this is still a concept. This is very much a conceptual project. Nothing is cooked, nothing is baked, nothing has been voted on. This is all something, no decisions have been made. This is all something that's very conceptual. The goal is to make sure that in Beach Cities fashion, we're bringing this to the community very, very early, because the goal is to have a project that reflects the community. We want to make sure that the community's fingerprints and handprints are all over the project, so that once it's built, you can see it and you can say, you know what, they did it this way because I asked them to. And that's really important, as you know, for Beach City. The other thing I'll say is we've worked with a lot of organizations. We've been in business for 21 years. And what we've seen with Beach City is really something special. We've been working with community working groups. We've been very methodical, trying to, put out information slowly, trying to get some information back. So when we got to this point, what we had was a reflection of the information, the input that we've been collecting. And it's been really fascinating and frankly wonderful to deal with the transparent nature of beach cities. Literally, some folks who we've had some meetings with, as they're looking at the new versions of this conceptual project, are seeing that there are some real changes that have taken place just in the last month. And that's truly been happening over the last 6 months that we've been moving this forward. So I say that because it's really important for you to understand that you have two cards in your hand. One is a blue card, one is a white card. The white card is a comment card. We want to hear what you have to say. We want to refine this project. We want it to continue to better reflect the community and your thoughts. Please write your comments down and turn them in so that we can, I can't tell you, the community working group, those members who are here are probably absolutely sick of me saying this, of hearing me saying this. They have been turning in these cards. We've had folks log in through the computer, through our website, providing comments, and I think people have been really surprised to see how those comments have been heard and reflected in the new designs. So please do send in those comment cards. Again, we're collecting them today. In addition to that, I talked about a facilitated Q&A. We want to make sure we're answering your questions because we're providing a lot of information in a very short amount of time. So these blue cards, if you have a question, whatever the question is, we want you to fill out this blue card so that we can answer your question. Let's see, where's Hannah? Hannah, why don't you put up your hand? And Catherine, I know Catherine's running around here too. There's Catherine. If you need a blue card, please raise your hand. If you have a question that you want to write down, you don't have a blue card, and you need a blue card, please raise your hand so that we can give you one. If you have a blue card that's filled out, please let us know, and Catherine and Hannah will be collecting those so that we can use those through this facilitated process. The other thing I want to note that as we're moving forward here right now, This is important. This is going to be important discussion. But really, the nuts and bolts of the project, the nuts and bolts of where we are, is outside here at the open house. Right now, we're going to be very quick. We're going to be very brief. We're going to give you an overview of the program, of the project, of Beach Cities, and then, you know, it'll probably last about 20, 30 minutes. And then we're going to ask you to go back, because that's where the nuts and bolts are. That's where you can see exactly what the project looks like today. You can see even what it looked like maybe 3 weeks ago. You can find out through the 3D animation, you know, if you live in the area, what that looks like and how that might impact you. You will understand better what the process is by going through the environmental process station. That is where you can ask your favorite engineer or your favorite Beach Cities employee specific questions about how it impacts you, okay? Here, again, we're going to do kind of a high-level discussion. So I want to make sure that you're clear about that. And so with no further ado, I want to introduce Tom Backley, who is our CEO, who's going to provide information about the overall project.
Thanks, Valerie. I'm going to move around a little bit. I may retreat back to the podium, but I think I'm just going to kind of wander around a little bit. I think the goal is to have more of a discussion. Valerie laid out some of the rules. One rule and one thing we will not talk about is the Dodger score. So I know everybody is here, so if you are following online or watching the score, please don't shout it out. And so that's the only rule. We want to talk about everything else, and hopefully you'll walk away with that impression, and maybe walk away with the impression that this type of meeting is a little different maybe than the type of meetings you've been involved with. That would be my hope, certainly. So first off, though, I want to introduce a couple of my board members who are here tonight. We have Vanessa Poster is here with BC Publishers, and then Jane Deal is also here. And I think those are the only board members that are here tonight, and we'll talk a little bit about our board and why that makes us a little bit different maybe than some of the other projects. So just want to tell you a little bit sort of about my background. I've lived in the South Bay for 5 years, been CEO of the Beach Cities Health District for almost a year. I grew up in Pasadena, and in my 20s, my friends and I would come down here and visit and party a little bit in the South Bay, and what I'd like to say today is I'm trying to be part of the solution, really, more than kind of the problem back in my 20s. And so that's something that I'm shooting for. One of the things that really helped me when I learned about the Beach Cities Health District is they helped me understand my purpose, which is to do the next right thing. And so I hope that you'll see that reflected from the Health District tonight, and also reflected from me tonight. You know, one of the things that I saw when I came to Hermosa, you know, I came from Park City. I was the city manager in Park City. I was the city manager in Hermosa Beach. And I came to Hermosa Beach, and I thought I was coming to kind of a sleepy beach town. And, you know, I missed that one. I missed it. You know, I had been around high quality of life communities my whole life. I worked in Pasadena, Park City, and Hermosa Beach, all very high quality of life cities. So I thought I sort of knew it. But it's different here. You know, I've seen that in the last 5 years, and I've seen what quality of life means to us. And it's something that's extremely important. It's something that gets 100 people out on the night of a Dodger game in the middle of the week. And it's that quality of life. And what we'll talk a little bit about tonight is that's the business that the Health District is in. We are in the quality of life business. And, you know, we want to have people live longer, healthier, happier lives. And so, you know, one of the things I saw when I came to Hermosa was high levels of stress. You know, I saw it personally. I was appointed right in the middle of the whole oil vote issue. So I saw it firsthand. And where I sort of became acquainted with the Health District was, hey, I'm seeing stress here. They were measuring it with Gallup polls as part of the Blue Zones project. We were about halfway through it when I came here, and so what we were seeing were these high levels of stress. And so we were able to partner with Beach Cities and come in and look at healthy ways to address that stress. So So I bet some of you are sitting here saying to yourself, well, what if I'm stressed out about the Healthy Living Project? Well, you're in the right place. And I don't want to be, coy or glib about it, but that's our goal, is to talk about how do we balance those issues, because stress reduction is one of our health priorities of our board. It's something that is extremely important to us. We believe there's a health need and a need for the Healthy Campus, and we'll talk a little bit about how we've gotten to that. And those are things that we need to balance. And so one of the things that I want to emphasize, and Valerie touched on it a little bit, is that, our board is elected by you. So this isn't just a stakeholder meeting. This isn't, just a sort of a meeting we're having to unveil a project. We're meeting with you sort of as the owners, if you will, because you are the voters. This is your property. And so we're meeting with you to get your input and buy-in into the project. And so we are at the concept stages. I know there's been a little bit of concern about where are we, with the application. We haven't applied for anything. Our board has not submitted an application. And again, we are at the beginning stages. And hopefully you'll see tonight, as Valerie mentioned, that we're changing things. We've talked to homeowners associations, we've talked to many of you, and so hopefully you'll see some changes from what you saw last time. So what I'd like to talk just briefly about, and just sort of kind of understand where we're going, I think you got to understand a little bit of how do we get here and what's our evolution been. And one of the things I've learned in the last year, I didn't know a lot about health districts before becoming the CEO, but one of the things that I've learned is that Beach Cities Health District has gone through an evolution. And so we started out in the 1950s. The three beach cities came together and voted to build a hospital. So at that time, under California state law, we were a hospital district. And so coming out of World War II, there was a need in California for rural hospitals. And so the state of California enabled that and allowed us to do that. The three cities came together, voted themselves a property tax or parcel tax to build the hospital. And so we operated, and I know it just doesn't kind of roll off the tongue that we were rural, but in late 1950s, early 1960s, we were rural, where the old South Bay Hospital, and that's what we're talking about when I say the project or the site. I'm talking about the old hospital building on Prospect and Merrill, and that was formerly, in the 1950s, a pig farm. I've seen the pictures. And so that was a need that this community had at that time, was for a rural hospital. So then what happened between 1960s and 1980s is it was operated as a hospital. That was the health need. That's what this community told us they wanted. And so it was operated as a hospital until the mid-80s. At that point, the district was financially having trouble making it work. They brought in an independent operator, Tenant. They operate hospitals today. They operate a hospital out in Palm Springs. Tenant gave it a shot for about 15 years. They're about 15 years into a 30-year lease, and Tenant can no longer operate the hospital as a hospital. And what had happened since 1960 to late 1990, the South Bay blew up with growth, blew up with other private hospitals and competition. And so huge growth in the area, and that's really what caused the South Bay Hospital to no longer be able to be operated as a hospital. So what happened in the 90s is the state law changed and allowed, and changed the name and allowed hospital districts to become healthcare districts. And so I think what happened at that time at the state of California, and also happened here in the three beach cities, is there was an understanding that health means much more than just sick care or hospitals. It means a whole wide range of other things, such as preventative health. And so that was the switch that was made in the 1990s. That would be innovative today. If people or other hospitals, there are 70 some odd other healthcare districts in the state, many of them are going through some of the same transition that we did back in the 90s. And so that was innovative for us to do, because one of the things we know is that 70% of the chronic diseases that people go into the hospital for are preventable. And so why wouldn't we focus on that? And so that was the change that was made. And today, we operate as one of the largest preventative hospitals in the country, or preventative agencies in the country. And so then the other significant evolution that happened that really, I think, has gotten us here today, in my opinion, as somebody kind of from the outside, but not really, has come in and kind of observed what's going on, is in 2010, we went through the Blue Zones project. And I think that really took us to the next level and really changed our culture as a community and how we look at health. And so how many people are familiar with the Blue Zones project and been involved with the Blue Zones project? Okay, well, that's what we've seen through our Gallup surveys, that roughly 77% of the people know who we are, and of that 77%, roughly 97% look at us favorably. And so when I see numbers like that, and believe me, working for cities for 28 years of my life, I never saw numbers like that, right? But what that tells me is that we're not, when we're giving ourselves, and again, I want to emphasize ourselves, we're not rating somebody else. We're not like, how are they doing? We're to get those kinds of numbers, we're really rating ourselves and saying, I'm a part of this, and this is something that I want, and this is something that I look at favorably. And I think that is where we've progressed to as a community. And so one of the things that we learned from Blue Zones, and we're continuing to learn today, is that Blue Zones really looks at a community approach to health, as opposed to treating, the independent sort of sick person. And so what do we learn from that? Well, we learned that the environment impacts someone's health. And so that's what we've learned through the Blue Zones project. We've seen successes with the Blue Zones project. Obviously, smoking rates are down, childhood obesity in Redondo is down. We're seeing success from the Blue Zone project, and it's sort of proving that point that the environment affects people's health. So where are we today, and what does that mean for the Healthy Living campus? And so, what that means for the campus is that we have a couple of things going on. We have an old hospital building, and we have a campus, or I don't even call it a campus. We have sort of a building with a sprawling parking lot that's car-centric, that was built in the 1960s at a time when Los Angeles was giving away right-of-way for the red car, and investing in this new thing called freeways. That is the building that houses sort of who we are as a community, that's leading the way in preventative health and community health. To a point where, we've had the Surgeon General, the highest ranking health official in the country, come out and the quote may be behind me, but, in so many words said, I think you guys have kind of cracked the code here, I think you might be on to this issue that the whole country is trying to address. And so we've done that as a community, we've done that together, we have the numbers to back that up. And then you walk into, a 1955 hospital building with sprawling parking, and they're just kind of this clunk, and it just, we're not walking our talk. And so that is something that I started to hear from the board of directors. I heard two things when I was hired. I was hearing this, our campus and building doesn't match who we are. And so what I was hearing from them is this shift that I just described, in our culture. And then the other thing I heard loud and clear was, if the first time that the public is hearing about this project is during the scoping meeting of an EIR, that's going to be a problem. So thank you for being here tonight, because we're nowhere near the EIR process. We haven't even applied yet. So that's a little bit about sort of how we got here. What I'd like to do is just talk for a moment kind of about our vision and our mission. I think everybody knows that, but our vision is a healthy beach community. Our mission is to enhance community health through partnerships, programs, and services for people who live and work in the 3 beach cities. So that's our mission. How do we make sure that our campus matches that mission? And then what we're going to talk a little bit also about tonight, and Carrie Ann's going to come up and talk about specifically, how does the healthy living community for older adults match that mission? And so we're going to talk a little bit about that tonight and walk through that. So again, I think one of the things that I really want to emphasize before I move on and talk a little bit about finances, that's something I'm very interested in my background, something that I've been interested in as I work with the health district. But one thing I just want to emphasize is that we've evolved to a point with the Blue Zones project where our mission doesn't match our home. And that's something that we really need to change. And so that's what we're looking at doing. We've involved the community in helping us with that. But again, we're just starting that process. So one of the things that the board did when we started the process is they put together some guiding principles. And so these are sort of fence posts, if you will, to help guide us through the project and help us engage the community. You can see community engagement is obviously one of those principles. There's another one on there that I do want to talk about that talks about funding, and it talks about growing the enterprise to support the mission. What is that? What does that mean? Well, what we were able to do when we made the transition from a sick care hospital in the 90s to one of the largest preventative health agencies in the country, what we did is we used those facilities. We took the buyout that we got from the lease and we upgraded those facilities, and they today continue to provide medical services, direct medical services, so people within the old hospital building can go for surgeries, they can go for cancer treatment, they can go to urgent care with UCLA. And what we do is we use the lease revenue to support our mission, which is preventative health. And so what that does is it allows us to leverage the property tax that you all, or the property owner before you, voted on back in the 50s. And so what we see today is that we're able to take that property tax dollar and basically multiply it by 3.5 times to provide the services that the community has told us that they would like and the state has allowed us to provide. And so we've sort of done what, many others haven't been able to do. When I hear that statistic about, preventative health and chronic disease, I kind of wonder why doesn't everybody do that? Well, because they can't fund it. There's no funding for it. And so what we've done is we figured out, people in the late 90s, like Pat Dreisler, I saw her here, and others, figured out in the late 90s that here's a way you do it. You take this building, you get rent for medical purposes, and you provide that medical service, but then you use that money to then provide preventative health. And so what that's allowed us to do today is, again, our property tax, when it was 100% in 1955 when we were building the hospital, it's now 25% of our budget. And we have lease revenue, and then we also have revenue that we receive from other facilities and partnerships we have. We have a facility up in Manhattan Beach. We have Adventureplex. I don't know if everybody knows that, but that's a facility that we own and operate. We also are in a partnership with Sunrise in Hermosa Beach. And so that's, you'll see probably up on the slide here, partnerships and over $1 million that we receive from some of our partnerships. That would be the Sunrise facility in Hermosa Beach. So this is something that we've looked at before. It's been a way, again, that we've provided a direct medical service to people that need it, and then taken that money and any additional money we have, we take that to provide services and programs. And so I want to talk a little bit about what those programs and what those services are. It's everything from working with the schools. We have an incredible partnership with the schools. One of the things that I've seen with other districts is a great benefit to us is that we have a defined boundary of the 3 beach cities. So if we have an issue or we have something with the kids, where do we go? We go to the school districts. We have something that we want to work on with built environment or streets or policy, smoking policy. We go to the city. Okay, there's going to be an opportunity for you to ask questions, and so.
Sit down and be quiet.
So we want to provide, again, there's that whole stress mission balance there. And so again, we want to reach that balance. We want to provide a little context. You're really going to learn about the project outside. So I hope, sir, you had an opportunity to see that when you came in. What we're providing here is more context for the project. So again, you're going to have lots of opportunity, if you haven't already, to learn about the project. So, and there'll be question time as well. So one of the things, in order to understand the project and understand why we have a need for the project, I think it's important that we know what services we're providing. And so what you see behind me are some of the services we provide, whether they're gardens at the schools or whether it's walking school bus. Again, working throughout the lifespan to create a healthy beach community. That's our vision. That's what we're working on. And so when we look at our campus, we look at the healthy living community for older adults, and Carrie Ann will talk about that need momentarily. That's our goal, and so that's what we're working towards. So again, I think again, goals for tonight, we want to get your input early. No application has been filed. Hopefully you'll have a sense that we're adaptive and listening to you and making changes. You'll already see that from some of the boards outside. And I think you also hopefully have an understanding that when you're standing up and yelling at us or making comments, that you're really doing that to yourself, because we're all in this together. We all own the Beach Cities Health District together. We're all voters for what we're doing. And so that I hope there'll be an understanding of that. And so I guess just in closing and kind of setting up the discussion about the Healthy Living Campus for older adults, one of the things we've done is a market study. So we've gone out and we've seen that there is a market demand for the older adult community for assisted living and independent living. We're seeing that there's a 3-year wait list in the 3 beach cities. And so we are seeing that there's a market need. That market study drove the number of units that you'll see in the project. And so, again, there's nothing magic about those numbers. They're conceptual, but they are based upon an assessment and a market study. And so that is something that you'll see. Other things that we hear from people are, we get letters, and I think Carrie Ann will share a story that she has about why we have a need for the healthy living community for older adults and how that matches our mission. And so with that, I'd like to introduce Carrie Ann Musson, and again, appreciate you joining us tonight and continuing our evolution. This is all part of our evolution to create a healthy beach community. So thank you.